Hi everybody, welcome back to UWorld's Next Gen NCLEX review session. My name is Jackie and I'm a nurse here at UWorld. We're so glad to have you guys with us today. We are covering mental health questions. So if you're new to these question drill sets, what you can expect is we will pull up the question, read it to you, give you about 30 seconds to answer, and then we will walk through why the correct answer is right. We have Nurse Samantha moderating the chat, so be sure and say hello to her, ask questions along the way. And again, we're covering mental health because it's one of the most requested topics that you guys have mentioned to us. So we hope today will be helpful. Be sure and share this session. And with that being said, let's go ahead and get started. Question 1. The nurse is reviewing telephone messages from clients. The nurse should first telephone the client who reports Option 1, a mild skin rash after starting lamotrigine. Option 2, decreased libido after increasing the sertraline dose. Option 3, dry mouth and constipation while taking olanzapine. Option 4, decreased appetite and insomnia while taking methylphenidate. 30 seconds on the clock. Drop those answers in the chat. Let us know what you guys think. I'm going to go ahead and enter into the chat myself, see what answers you guys are picking. And again, if you guys are just tuning in, just joining us, we're covering mental health questions today. We are on question 1. And we have 8 questions, so we're glad to have you all with us. We're going to be covering different conditions, medications, some therapeutic communication, things like that. So hope it can be helpful to y'all. All right, I'm seeing a bunch of answer 1s. Y'all are doing great. I'll give y'all a few more seconds to answer, and then we'll go through it. All right, good job, everybody. Good job, good job. Oh, thanks for all the follows and shares. All right. So our correct answer on this one is going to be option 1. So starting with this question, we see the word first bolded. That's going to indicate that this is a prioritization question. So we need to use some of those prioritization strategies. So a lot of times we can start with the basics, our ABCs, airway, breathing, circulation. One of these answers is going to be the most right. Well, there might not be. Well, we can maybe justify some of these. One is going to be the most important. So another way we can go about this too is findings that maybe indicate a complication versus what's expected. So expected versus unexpected. So let's kind of talk about what is being described to us in option 1. So we know that we have a client with a rash and they're also taking lamotrigine. So one of the complications from anticonvulsant medications is the risk for Stevens-Johnson syndrome. So this is an immune-mediated response. A lot of times it's triggered by certain medications like anticonvulsants. So it can be a life-threatening complication. So we need to immediately discontinue this medication and then provide supportive care. So Stevens-Johnson syndrome is going to present kind of with some non-specific symptoms at first. So think like fever, flu-like symptoms, some fatigue, but then it's going to progress and we're going to have these manifestations of like a pretty severe rash and injury on our skin. So after flu-like symptoms, we're going to progress to a mild burn-like rash and blistered lesions. A lot of times this can also involve our mucous membranes. So anytime we have this type of injury to our skin or to our mucous membranes, it's going to increase our risk for sepsis and then kind of subsequent septic shock, multi-organ dysfunction. So we have a huge risk of infection anytime that kind of protective layer to our body is impaired. So we can also experience epidermal shedding as well on the face, trunk, and palms, and this is going to be pretty painful for these clients. So we know the risk of Stevens-Johnson syndrome can be fatal, life-threatening. We need to address this client first. They are our priority. What we see in options 2, 3, and 4, these are going to be expected findings, nothing that's extremely alarming or life-threatening at this time. So option 2, decreased libido with sertraline, this can be expected. Dry mouth and constipation with olanzapine, this again is expected. It's an anticholinergic medication, so it's going to help it's going to dry up secretions, whether that's therapeutic or not for the purpose of taking it. And then decreased appetite and insomnia with methylphenidate. This is also Ritalin. So this is something we often will see for clients taking that medication, just something we need to provide education on to the client or the caregiver. All right, good job, you guys. Well done. Moving on, question 2. The nurse is observing staff members caring for a client who is experiencing delusions. The nurse should intervene if a staff member is observed. Option 1, distracting the client with music. Option 2, opening snack packages in front of the client. Option 3, debating the content of the delusions with the client. Option 4, telling other staff members to avoid whispering near the client. 30 seconds on the clock. Drop those answers in the chat. Good work, you guys. All right, let's see those answers. If anybody is new to these question drill sets, one of the things we recommend you do is check us out at uworldnursing.com. It's kind of our home base for all things UWorld Nursing and our UWorld Nursing community. You can subscribe to our event calendar, find information about our subscriptions as well as our free trial. We also have information up there on our question of the week, which is something fun you can subscribe to as well. We'll send you a question, a UWorld question, NCLEX styled question every week. You can answer it in the email, and then we'll give you a full explanation like you would see in our UWorld platform. So you'll see images, our great explanations walking through why the correct answer is right and maybe why the wrong answers were distracting or what made them wrong or what would make them right. So we hope you'll check it out. It's kind of fun. Test your knowledge once a week. All right, very good, very good. Good answers. I'm seeing a bunch of option 3, so well done. Our correct answer on this one is going to be option 3, debating the content of the delusions with the client. Okay, so we see in this question, starting with what it's asking us, we know our client's experiencing delusions. The nurse is, the question says intervene. So we're looking for the action that's incorrect. So our correct answer is going to be the incorrect action. I'll say that again. So our correct answer is the incorrect action. Anytime we see that word intervene, we want to find what's going wrong, and that's going to be our correct answer. So delusions, just kind of in general, are false beliefs that the client is so strongly rooted in believing to be true. So delusions can't really be changed like by logic, reason, or persuasion. So we need to make sure when we're communicating with a client experiencing delusions that we use non-judgmental statements to really reconnect the client back to reality and not challenge them on what they're seeing or what they're believing. Again, what they are experiencing is true to them, and it can cause them real anxiety. So again, for a client experiencing delusions and also having anxiety, we need to really prioritize those interventions that are going to reduce that client's anxiety. So debating with them is going to increase that anxiety. We definitely want to kind of divert their attention the best we can, which is what we see in option 1, and then lessen that anxiety. So opening snack packages, what we see in option 2 in front of them, that's going to assure them that they're not seeing any or that they feel comfortable in knowing nothing's been tampered with. And then also whispering can maybe give the perception that other people are talking with them, about them, which we don't, again, want to increase their anxiety, want to make them feel more nervous or more anxious. So good job on that one. Well done. Question 3. The nurse is assessing a client with serotonin syndrome. Which of the following findings would the nurse expect to observe? Select all that apply. Option 1, diarrhea. Option 2, myoclonus. Option 3, lip smacking. Option 4, hyperreflexia. Option 5, body tremors. All right, 30 seconds on the clock. Drop those answers in the chat. Let us know if you guys, this is our favorite question to ask, but let us know if we have any new NCLEX passers on the live today. We would love to celebrate you guys. If we have anyone getting ready to test, we would love to wish you good luck. So let us know where you guys are in your NCLEX journey and where you are in nursing school. We really, let's see. Oh, someone just said that they love UWorld tests. That's so great. We hope it can be helpful for you. Good work, you guys. But again, we love celebrating you guys, so let us know. All right, I'm seeing a bunch of 145s, 1345s, 1245. Good work. Good luck to Jessica, who's taking her NCLEX next week. You're going to do great. You've got this. Just be confident. Another test taker is testing tomorrow. Any advice? Just get a good night's sleep. Be confident. You guys have got this. Good work, you guys. All right, so our correct answers on this one are going to be options 1, 2, 4, and 5. So pretty straightforward. Select all that apply. We're going to have more than one right answer. We need to address all the options independently. They're all going to be standalone. They're not dependent on anything else in the option choices. So serotonin syndrome, really just kind of what we're trying to focus on with this question. It's a life-threatening condition, and what happens, it's due to excess serotonin in the central nervous system. So we can experience serotonin syndrome anytime we start a serotonin-containing medication or we increase the dose of a serotonin-containing medication. So anytime, again, we're starting or increasing that serotonin dose, that's when we can start to see these manifestations. So that could be medications like SSRIs, SNRIs, or anything containing serotonin. So a lot of times the manifestations of serotonin syndrome can happen within hours, like several hours, and they're going to focus on kind of three like umbrella terms of conditions. So we can have altered mental status, so think about like agitation, confusion, all the way to hallucinations. Autonomic symptoms like high fever, hypertension, tachycardia, so kind of like an agitated autonomic system. And then GI symptoms, so think about diarrhea and hyperactive bowel sounds. So a lot of times serotonin syndrome will kind of help itself once we discontinue that medication, but we need to provide a lot of comfort and safety measures for these clients while they're processing the serotonin from their syndrome. So this could be monitoring the heart if we're having tachycardia, providing cooling blankets, and other supportive measures. So again, what we're seeing in options 1, 2, 4, and 5, those all fall under those kind of umbrella terms. The autonomic symptoms, altered mental status, and GI symptoms. What we see in option 3, this is something associated with tardive dyskinesia and is typically a side effect of antipsychotics. I'm so sorry. I tried to cough away from the microphone, but I don't know if I did a good job. I'm sorry about that. All right, question 4. The nurse is teaching the parent of an 8-year-old client with attention deficit hyperactivity disorder. Which of the following information should the nurse include? Select all that apply. Option 1, minimize distractions while completing homework assignments. Option 2, decrease the number of breaks between activities. Option 3, collaborate with teachers to allow extra time when taking tests. Option 4, provide a list of activities and goals for self-care. Option 5, use a sticker chart to encourage completion of household chores. 30 seconds on the clock. Drop those answers in the chat. Let us know what you guys think. Good work. I'm going to get a sip of water so I don't burst the microphone. All right. You guys are doing great. I'm seeing 1, 2, 4, 5, 1, 3, 4, 5, 1, 3, 4, 5. Good work, you guys. And let us know, too, if you guys are part of our regular kind of viewership. If you guys join us every Tuesday, Wednesday, and Thursday, just as a reminder, we go live with a lecture from Nurse Samantha on Tuesdays at noon Central Time. We're live on Wednesdays and Thursdays at 11 a.m. and 3 p.m. Central Time doing these question drills. So we're glad to have you all with us. Oh, good luck to our user that is using UWorld, and you have your test soon. I just saw it come on Saturday. Good luck, good luck. Well done. All right, our correct answers are going to be options 1, 3, 4, and 5. So again, we're talking about statements we should include, teaching we should perform. We're looking for the true statements in this question. So we have a client that has ADHD. So this is a neurodevelopmental disorder. It's going to be characterized by inattention, distractibility, and/or hyperactivity. So children with ADHD, sometimes they can be restless, have difficulty staying seated, talk excessively, even interrupt others. And then that inattention element to it is going to be characterized by a reduced ability to focus and complete tasks. So that's going to kind of be a lot of what we're going to teach these clients and caregivers about. So clients with ADHD can struggle to control sometimes that impulsive behavior and have some emotional dysregulation. So going through these options, option 1, minimize distractions, we definitely want to do that. We want to give these kids the best chance of staying focused, and eliminating as many distractions as possible is going to help them really focus all of their attention on the task at hand. Option 2, decrease the number of breaks between activities. This is a false statement, so an incorrect option. We want to increase the number of breaks. We want to try and break things up into small chunks the best we can. Having to really extend that time of focus is going to be really challenging for these clients. Option 3, collaborate with teachers. This is going to be kind of alluding to the idea of accommodations. So this is definitely something that we want to, everyone that is needed to be involved with these conversations, teachers, counselors, parents, the student, and make sure everyone's on the same page to help provide the best resources and tools for these students and kids. Option 4, provide a list of activities and goals for self-care. Definitely goal setting and kind of task and simplifying things is really helpful for kids with ADHD, just to kind of help them go step by step along the way and really be able to achieve something and set those goals. And then option 5, using a sticker chart, definitely a good visual for accomplishment and incentive. So you can use stickers, and once you get to the end of a task, you maybe can get a toy or a prize or something like that, but incentivizing the sticker itself can be the incentive. Just anything like that provides encouragement and motivates them. So good work, you guys. All right. Question 5, the nurse is caring for a client with panic disorder who is experiencing tachypnea, dizziness, and diaphoresis. Which of the following actions should the nurse take? Option 1, administer a citalopram to the client. Option 2, teach the client how to perform guided imagery. Option 3, instruct the client to take deep breaths and bear down. Option 4, stay with the client and communicate calmly and clearly. Go ahead and drop those answers in the chat. Let us know what you guys think. Awesome work, you guys. Good work, good work. I'm seeing a lot of option 4s. Y'all are doing great. Some 3s and 4s. Good work. Nice job. Let us know, too, if you guys have taken your mental health course or maybe done your mental health clinical rotation. I know for me, when I did my mental health rotation, it was definitely very memorable. I think it was one of the rotations or clinical experiences where you really get to apply so much of what you learn in nursing school, like as a student nurse, talking with different clients and seeing all different types of mental health conditions. So it was definitely a cool experience. And let us know, too, if you're interested in mental health nursing. We have a lot of great mental health question practice on our platform and resources for you guys. All right, good work. Our correct answer in this one is going to be option 4. So what we see being described in this scenario, we can kind of use the nursing process to help answer this question. But essentially, our assessment findings are all being addressed in this question. So this client is likely experiencing a panic attack or a panic disorder. So we kind of have our assessment, a little bit of our diagnosis. Now we're going to be kind of moving into the planning, care, and intervention part of our nursing process to answer this question. So when we're dealing with a client who's experiencing a panic attack or anxiety, like an acute episode of anxiety, we really focus on kind of a few different measures with them. We want to stay with the client and we want to remain calm. Not only do we want to be calm, but we want to encourage them to be calm. So that's exactly what we're seeing in option 4. What we see in option 1, administer is citalopram. This is like a maintenance medication. It's not fast acting. It's not going to really help in this acute setting. What we see in option 2, in the midst of a panic attack, we're not going to teach a client to do something new. It's not really the time where they're going to be able to follow instructions, retain information, do anything like that. We're not going to focus on something that's that complex in this kind of acute, heightened time. What we see in option 3, instructing the client to take a deep breath and bear down, this really is more associated with SVT or supraventricular tachycardia. This would be how we would instruct these clients to help kind of slow that heart rate down, reset that rhythm. And then option 4 is stay with the client and communicate calmly and clearly. This is what we want to do. Again, we want to provide that security. We want to help them remain calm, help them get through that episode, and then be with them afterwards as well. Good work, you guys. All right, question 6. The nurse is observing a staff member caring for a client with generalized anxiety disorder. The nurse should intervene if the staff member is observed. Option 1, assisting the client to identify factors that contribute to symptoms of anxiety. Option 2, requesting a prescription for lithium to treat acute symptoms of anxiety. Option 3, encourage the client to perform deep breathing exercises. Option 4, recommending that the client limit the intake of caffeine. All right, drop those answers in the chat. 30 seconds on the clock. You guys are doing great. Let us know how you guys are studying. Is UWorld part of your kind of nursing school or NCLEX prep tool belt? Do you guys like doing practice questions? Do you like lectures, videos, joining lives like this, note cards? Let us know. We love to know if UWorld is helping you guys, if you're interested in learning more about UWorld. But we're glad to have you here, and we love learning about what is working for you guys and how we can improve what we do. That's why we're here. We're here solely for you guys. We want to make sure that you're successful in nursing school and pass that NCLEX and the next great generation of nurses. All right. Good job, you guys. Good work. Okay, correct answer is option 2. So again, this question says the nurse should intervene. So when we see intervene, just as a reminder again, our correct answer is going to be the incorrect action. We need to find what is not correct, and that's our correct answer. So we are talking about, again, a client with generalized anxiety disorder. What we see in option 2, a prescription for lithium. Lithium is a mood stabilizer, something a lot of times we give for bipolar disorder. It's not going to be an appropriate medication for acute anxiety or anxiety. But appropriate medications are going to be, for anxiety, would be medications like benzodiazepines like lorazepam or alprazolam. So that would be the more appropriate intervention. What we see in options 1, 3, and 4, these are all appropriate interventions to take. We want to encourage the client to perform deep breathing, help slow that heart rate down, help them kind of pass through that heightened moment of anxiety. We want to limit the intake of caffeine. That's going to kind of be an agitator to our nervous system. We want to help keep everything as calm as possible. Again, we talked about kind of our main themes in intervening with anxiety to be focusing on stay and calm. So staying with the client and staying calm. And then what we see in option 1, this is all about identifying those triggers to that panic attack or to that anxiety. Being able to identify what really kind of tips the scale to panic or, kind of spiraling thoughts. That's really going to help clients know if they're approaching a trigger, experiencing a trigger, and kind of help them work through it. So we definitely want to understand help our clients understand what triggers their panic and help them avoid them or help identify them so they can do their best to work through it. Good job, you guys. All right, question 7. The nurse is caring for a client with bipolar 1 disorder who is receiving lithium. The nurse should recognize which of the following are risk factors for developing lithium toxicity. Select all that apply. Option 1, dehydration. Option 2, hyperkalemia. Option 3, hyponatremia. Option 4, hepatic cirrhosis. Option 5, acute kidney injury. 30 seconds on the clock. Drop those answers in the chat. Good work, you guys. Awesome, awesome. I see someone had a question about select all that apply questions. So select all that apply questions mean you're going to have more than one correct answer. So all options are going to stand as on their own. If with a single best question, maybe like a priority question, one answer option is going to be the most correct. So, but with select all that apply, everything stands on its own. So one of our best tips as you go through them is to go through each option choice and answer it like a true-false question. So for this one, is dehydration a risk factor for lithium toxicity? True or false? If it's true, it's a correct answer. If it's false, it's not. But you also have to pay attention to what the question's asking as well. So you're either looking for those true answers or you're looking for those false answers. So just take your time, read through it. Anytime you see more than 4 option choices, it's probably going to indicate it's a select all that apply question. And you're always going to see those words select all that apply, meaning you're going to have more than one right answer. I hope that was helpful. Good work, you guys. Well done, well done. I'm seeing 3, 5, 1, 3, 5, a lot of 1, 3, 5s. Good work. Nice job, you guys. All right, our correct answers are that, 1, 3, and 5. You guys did great on that one. All right, so we kind of talked a little bit about lithium, but kind of just going to what the question's saying, we're looking for risk factors for lithium toxicity. Lithium toxicity is going to be a buildup of lithium in our bloodstream, so let's kind of talk about it. So lithium, again, we know is a mood stabilizer. A lot of times we give it to treat bipolar disorder. It has a really narrow therapeutic index, so we need to monitor these clients really closely to make sure that they don't have a toxic buildup of the medication in their system. So a lot of things that can be risk factors are going to be related to excretion through our kidneys of the medication or too high a concentration of it in our blood. So risk factors, again, are going to be dehydration, hyponatremia or low sodium diet, and acute kidney injury. So again, think about anything that would lead to filtering problems or dilution problems. So dehydration and hyponatremia, they're going to trigger the release of antidiuretic hormone, which essentially is just going to send anything we were trying to excrete through our kidneys back into our bloodstream. So, kind of envision your blood makes it to your kidneys, it gets filtered. Instead of creating urine from that blood, we're sending it back into our bloodstream. So that would be one, acute kidney injury and hyponatremia, and dehydration. And then also, I lost my spot here. We always want to teach these clients to have, to maintain a correct fluid volume, so an adequate intake of sodium and an adequate intake of fluids. A lot of times lithium toxicity can present with some GI symptoms, so we can have some nausea, vomiting, diarrhea. Late manifestations are going to kind of be in our head, so think agitation, slurred speech, tremors, and even seizures. So what we see in option 2, hyperkalemia can indicate that maybe we have a kidney injury, but it's not directly associated with the lithium. Something we obviously want to monitor for, but it's not a risk factor for lithium toxicity like hyponatremia is. And then hepatic cirrhosis. Lithium is metabolized through our kidneys, not so much our liver. We're not worried about liver cirrhosis with lithium. So we're more focused on our kidneys in this situation. So good job on that one. I hope that was helpful. All right, last question. The nurse has attended a staff education program about ketamine. Which of the following statements by the nurse would indicate a correct understanding of the program? Select all that apply. Option 1, clients who are receiving ketamine may experience hallucinations. Option 2, bradycardia and hypotension are common adverse effects of ketamine. Option 3, nursing care should be clustered for clients who are receiving ketamine. Option 4, ketamine can be used to treat clients with treatment-resistant depression. Option 5, administering a selective serotonin reuptake inhibitor with ketamine can reduce adverse effects. 30 seconds on the clock. Drop those answers in the chat. Again, we hope you guys will come back tomorrow at 3 p.m. Central Time. We'll be doing another question drill set. Let us know what you guys think. And if this was your first time to join us on one of these question drill sets, let us know. We're glad you're here, and we hope you come back for more. Again, we go live Tuesday, Wednesday, and Thursday. Tuesday, we do a lecture at noon Central Time, and then Wednesday and Thursday we do question drill sets to do some question practice. All right, I'm seeing 1, 2, 3, 2, 3, 4, 1, 2, 3, 5, 1, 3, 4. A good mix of these, so we can cover this in more detail. All right, good work, you guys. Okay. Our correct answers on this one are going to be options 1, 3, and 4. So again, we are looking for correct understanding. Our correct answers are going to be our true statements. So let's talk about ketamine. So ketamine is given for multiple reasons. It can be for pain management, depression treatment, and even for sedation. So how it works, it binds with receptors in both the central and the peripheral nervous system, including those opioid receptors, and it's going to mimic the effects of opioids. A lot of times, it's going to have like a low incidence of reducing like cardiovascular, respiratory, and bowel function, so it works different than opioids would. But some of those adverse effects are going to be psychomimetic effects like hallucinations. So let's kind of, knowing some of this background, let's apply it to this question. So clients who are receiving ketamine may experience hallucinations. True statement. We just learned that you can experience those psychomimetic effects. So hallucinations can be a side effect of ketamine, maybe the too high a dose of ketamine. Option 2, so true statement, correct answer. Option 2, bradycardia and hypotension are adverse effects. This is an incorrect statement or an incorrect option. A false statement, incorrect option. A lot of times our cardiovascular system is not affected like it would be with opioids. Option 3, nursing care should be clustered for these clients. True statement, correct answer. We definitely want to reduce the interruption and interference with these clients when they're receiving treatment. Option 4, ketamine can be used to treat clients with treatment-resistant depression. This is a true statement. This is one of the uses of ketamine is for that treatment-resistant depression. After many medications and other measures have been taken, sometimes ketamine treatment can be beneficial to clients with depression. And then option 5, administering a selective serotonin reuptake inhibitor with ketamine can reduce adverse effects. A lot of times we're not going to give them together. That's a false statement, incorrect option. So you guys did really well on that. Let us know how you guys did out of 8. Drop it in the chat. As always, we thank you guys so much for joining us today. We hope you learned something new. We hope you'll check us out at uworldnursing.com, subscribe to our event calendar, and we hope to see you next time. Thanks again for joining. Bye.